Yeah. Hey everyone. So here we are live again. And today, as I said, it's a very exciting live. We are having Dr. Preethi Kulkarni. She's an orthodontist and has been practicing since many years now. She is a champion with Invisalign, invisible braces, and a lot of treatment modalities as well. She's one of the finest orthodontists that I know of, and I can literally swear by it. Like, if you have any doubts, she's just a call away for everything. So, welcome, Preeti, and it's so great to see you here.
Hi, Dr. Ankita. You look as beautiful as ever, and thank you for inviting me to this chat together.
Yeah, every time I see you, have like tons of questions to ask you. uh, and as we know that we've been doing so much work around Airway or orthodontics, and we know the challenges that today we're facing. There's so much to discuss around, like how breathing, airway, your jaw and teeth position, and whole of orthodontics is related today. And it's such a great job that our dentition and with every collab, you, me, and a lot of other doctors, we are all trying to build this awareness amongst doctors as well as patients, like how to look at these problems, which we're not paying attention to these problems really, like today. And it's commendable, and I think we can start our discussion today. What do you have to say, Dr. Preeti?
Yes, so I think as doctors, it is extremely important for us to keep on updating our knowledge, and with so much of research around us, and you have actually been that nudging force for me to get in, get through these cases. There's so many advances that are happening. Continuous education, I should be mandatory or for us, in our practice.
I
So
agree.
yeah, it is. It does, always raises our bar. We have to push ourselves to the next level.
True. And I just feel like there's so much developing why not learn? There's so much to learn today. And I think a lifetime is also not enough to continue learning. Every time you learn something new, and we should just update ourselves like that.
Yeah,
So,
absolutely.
no, absolutely right.
Yeah.
And so, not wasting any time, let's get to like our first question. So, Dr. Preeti, like, what do you think, like, as an orthodontist, why do we really play, or as a dentist per se, why do we really play such an important role here with the airway?
So in all these years of my practice and so much of attention to it, there is so much that we can achieve as orthodontists, because your airway is right behind your jaw structures. So there's so much that we can do and we can modulate to get good results, provided if the patient comes to us at right time, where we will really, we can do justice to the case. And if we as patients are also aware, our eyes are trained to catch those right signs regarding airway and jaw positioning. So yeah, I think like for orthodontists, like our expertise lies in moving of the jaw structure and modulating the growth of the child. So I feel that orthodontic treatments do play a very, very large role in maintaining a good way and achieving probably a good skeletal structure. Then just aligning your teeth becomes extremely simple. So that should be our ultimate goal as to any for any treatment modality. And for a matter of fact, I know that you work through all these younger children, and you are very, very efficient in identifying these small signs, motivating the parents, and even the doctors working with you to get them corrected at a very early age. So even I wanted to ask you, like, as a pedodontist, how many kids you see in your practice with these problems?
Yeah. Dr. Preeti, I think there's some audio discrepancy, or the Wi-Fi is cutting. If you could just check your internet once.
One
Uh,
minute. Is this better? Is
yeah,
this
this is so
better?
much better.
Am I audible?
Yeah.
Okay.
So much. So, interestingly, I just wanted to add one more point that, if we look at it anatomically, our jaws are right in front of your airway. And interestingly, if you consider
Absolutely.
that as your nose, and that as your upper jaw, basically the floor of your nose is actually the roof of your upper jaw. So the minute the upper
Correct.
jaw is narrow, we get a narrow nasal cavity, and we also get a lot of deviated septums. So a lot of times, if we are very sharp at observing people with crooked noses or they have a little deviation in septum, you will generally find like a deep palate in these patients. And
Yes.
interesting, that's how, a lot of such signs on the physical side, we come to know that there is some issue over there.
Yeah.
And with kids, as you asked me, it's, I would say, 1 in 5 kids. I'm observing so much of mouth breathing and jaw discrepancies. Jaw discrepancies, crooked teeth, and like I would say, modernization has changed. A lot of soft food consumption, a lot of packaged food, a lot of bottle use, those 360-degree cups. So they are actually not developing these mature swallows,
Correct.
and so much mouth breathing that the whole jaw structure is changing. And the minute I'm identifying these things early on and I'm changing these habits, or just correcting facial dysfunctions like muscles, some exercises, I'm seeing like so much dramatic change. These kids express, that I'm feeling better to breathe. I feel easy to swallow. I'm finding these things easier now. And we actually see so much of a change on their facial growth also, that their whole jaw structure is changing the minute we start correcting these functions.
Correct. So, and with so many cases that, we have been working with also, when I look at the profile and I look at the nose and people will be like, you are the one, you're drawing my attention to the back of the jaw always. So, I guess this is a very good give and take, and we should have a holistic approach and, to kind of actually treat the patient so as to give him a good facial structure, but also maintain probably healthy functions along with that. So I know for a matter of fact that you keep telling me a lot of important signs that you have to note in children at that age, or even in adults. You keep nudging me that, oh, you missed this, probably you have to look into this. So can you give us a few important signs that we have in patients having or
Right.
breathing issues?
Right. So, like in children, I often, like, when I'm assessing them, I often look at a little sleep questionnaire and a breathing questionnaire. So these are the signs that I look for. That are they tossing and turning in bed? Some parents say that वो पूरा 360 डिग्री घूम जाता है, 8 o'clock पे सोता है, 3 o'clock पे उठता
Correct.
है. Like, so they are either in a bundle of clothes, or they're sleeping on their tummy, or they sleep with their neck extended. Sometimes, if you dig deeper, they will say that yes, they're snoring. So the first time when you ask them, they will never say that because they've never noticed it. But the minute you've told them, they will start observing more, and then they come back to you and they'll tell you that, yes, doctor, I think I have observed my child sitting with the lips open more, or he's sleeping with his lips open more, or he's snoring. These kids also have frequent tonsils, adenoids, cold, cough, ear infections. Grinding is one very common sign in these kids. They are clenching their teeth already. I would also say that as doctors, you should start looking for thumb sucking. Look for a deep palate. Look for retruded position of the jaws. Sometimes even if like we are in a class one occlusion, visually it looks so beautiful, but actually when we go to see the cephalograms or x-rays, we'll understand that the jaw is quite retruded, though it's in a class one. So that's something which doctors should start looking out for.
Yes.
Retruded jaws, narrow, long faces, crooked nose. These are things which will help you with children, identification wise.
Also, very interestingly, I've seen that also you're trying to symptoms to a lot of airway obstructions. And so do you want to come up with some pointers that we have to this?
Yeah. So even in adults, if you see that I would say, if you again go into a sleep questionnaire, these are basic orthodontic signs that you will see. Sometimes, teeth beautifully compensate. Our bodies are made wonderfully. We
Absolutely.
tend to compensate for everything. So even
Oh,
if you're narrow, your teeth are going to incline. Yeah, it's
yes,
just very interesting how we compensate for everything. And we
yes.
actually compensate and bring about more damage.
I know.
So even if like your narrow jaws, your teeth are going to beautifully compensate and show it in a way that, okay, no, you're appropriately biting, but actually, if you go to see the X-rays, your teeth angulations might not be correct. They may be way out in the bone, or the angulations are like this, or they're like this, compensating for the skeletal discrepancies. But if you go to see on the sleep side in adults, I generally come across questions like, they feel too much fatigue, or they feel very tired. Tired means like, even if they've slept, they'll say like, I slept for 10 hours, but I still feel tired through the day. That's the kind of tired feeling. They never feel fresh in the mornings. They're typically not a morning person kind of people. They have sensitive teeth. They'll complain of a lot of joint pain, jaw and muscle pain all over here. When you touch, they'll be so sensitive to that this is all because of the clenching. All these muscles start getting sore, and eventually they'll end up with a lot of joint pain.
Yeah,
They complain of headaches and migraines a lot.
yeah,
They complain of a lot of neck pain, shoulder, body pain, because they're always forward neck, trying to bring their head forward and breathe more. It's natural that you will keep on doing this, and you end up with a lot of neck pain then. So, couple of these signs, like posture related, also, I would say you often see like forward neck and forward shoulders, in these people. Crooked teeth, very, very common for all adults as well.
yes,
A lot of ear pain, pressure behind the eyes. They also feel very moody and irritable quite often. They just feel anxious, and they just don't know. They can't figure out what are they going through. Even like I would say in teenage population or the early adolescence, I come across a lot of signs of depression also with this,
is it?
which is yeah, yeah. It's very sad that because they are unable to figure out what's happening to them, they go into such phases of anxiety and depression because of this.
Yeah. So I think Airway, I mean, more thoughtful we go for expansion of jaws. We as orthodontists have always been trained to look at cross bites, when we have expansions as our treatment modality. But there is so much more to, like, just narrow jaws that you have to look up when you have to consider, like for restricted airways, we have seen that expansion has has given beautiful results as to, opening up the jaw space, giving up more space for the tongue to be placed, and resolving so many problems. So I think expansion of the jaws is very, very important, has to be considered in all these cases.
True, true. And in fact, remember, Dr. Preeti, we had this really interesting case. I think she was an adolescent teenage girl,
Yes.
and she had these previous orthodontics, and she had a narrow jaw. But because of the narrow jaw, we had compensated. We are not correct. She was not corrected skeletally. She was only dentally corrected, and she came up with so many signs of jaw pain, TMJ clicking after the orthodontics, and she had these sleep issues, anxiety issues. She had ear pain. I also remember she was complaining of a lot of neck posture problems and breathing difficulties. Every time she had nasal congestion, every time she wakes up in the morning, the nose is congested. She kept on feeling sick all the time. The
Correct.
minute I remember, the minute we started correcting or widening the jaw, we corrected the muscle dysfunction. We worked on
Yes.
her myofunctional therapy, that her tongue therapies,
Yeah.
and we worked on a little bit of tongue positioning, the tongue ties, and all of that. All these signs just disappeared for this child.
Absolutely, and even the mother could tell that, that she's sleeping better, she's eating better, she's swallow. I mean, the patient came up with, things like, I could swallow better, as you said. That I mean, it's very surprising that small changes can actually do such good difference to the patient's functioning.
Yeah. And I honestly feel like today that throws so much importance to us as doctors that we should look at skeletal corrections and not just masking those corrections today. Yes, those who don't have signs and symptoms, agreed, but those who have these signs and symptoms, I think it's best to correct them naturally, as natural as possible.
Yeah, absolutely. I agree. And that's why, I mean, things like the maxillary expanders and positioners, they play a very, very important role into this. And we should, kind of take into consideration when planning such cases.
I agree. Dr. Preeti, what's your take on retraction orthodontics, extraction and retraction orthodontics?
So, extractions in orthodontics has played a very, very major role, in planning the treatment. But of late, there is so literature that, premolar extraction especially has no sizes or maybe planned up with protruded, which leads to, space and obstructed airways. So probably, our for success orthodontic treatment outcome should be a good amalgamation of proper positioning of your jaw, a good patent airway, like good fun, and then aesthetically pleasing smile or facial structures. So nowadays, even orthodontists are being extremely conservative to have your premolar extractions done. So a lot of other options like extractions of wisdom teeth are being considered. There's proximal reduction. So all of these measures should also be considered. And when it is most important, then probably yes, have to do extractions. But in those cases, we do analyze your airways and more holistic approach to actually getting a good result should be kept.
Right. Yeah, and interestingly, on the airway side, when we understand this, that the more we pull it behind, we are reducing more tongue space. The tongue
Correct.
is not going to shrink in size, right?
Yes.
So if there is a reduced tongue space, it's all the more going to fall back into the airway, and this is going to increase the signs of the airway rather than actually reducing it. And also, when we are pulling back, we are locking the jaw behind. So this also results in a lot of jaw pain after some time because they start clenching and they start clicking. So actually, the more we go behind, we are actually increasing these signs rather than resolving them at that time.
Yes. So that in our practices also we are like very, very conservative to approach extraction and only when at most necessary. Sometimes I leave some kids with a bit of it looks good on their face. I mean, you need not have attain that angle of upper laser to your nose, but on their face, it just looks perfect. And is the child going to look face throughout their lives? No, the face is going to mature deeper. And we all know that, as we grow, our faces because any which ways the teeth are going to look retreated. So it's okay if a little bit of protrusion is left,
Right. Dr. Preeti, again, I think your internet, because I'm getting some messages on, you can just
okay.
check. So in the meantime, I think someone's asked me how early to intervene for clenching in children. As early as you see it, like clenching is a sign to open up your airway. You are going to get your jaw forward when you're in a deep sleep, and that is when you're starting to clench. So clenching, the minute you see it, evaluate for any magnesium deficiencies, evaluate if the child has any worms, has taken any deworming, and the minute you start analyzing these things and still your clenching is not resolving, it's pretty much there that it's a red flag that there is an obstruction to the airway. So the minute you start correcting the jaw growth, the minute you start getting it forward, the minute you start correcting tongue positions, the minute you start correcting muscle functions, you can just get rid of the clenching over there. So, Dr. Preeti, I hope now the voice is clear because a lot not audible.
Not audible.
Yeah, audible, audible,
Okay.
audible. So, what do you think that how soon can jaw growth be corrected?
So as orthodontists, we always say that get your children at the age of 7, as early as 7 years of age. The American Dental Association supports that and says that is a good age to come to an orthodontist, because at that age, the magic that we can do with the correction is phenomenal. Once the child reaches a pubertal growth stage, then uh, it becomes a little difficult and correct, and you cannot get as results. You have to have a more invasive approach in such. So, many times patients come and tell me that, oh, but our dentist said that maybe you have to keep your permanent teeth erupt, or maybe till 12 years of age. But, I always advocate that there's no harm in just getting a consultation at the age of, and whether your child requires any sort of skeletal correction. If not, I mean, if it's just teeth alignment, you can wait till the teeth have come. But otherwise, considering that, I mean, early intervention will help us a lot to give better results.
Yeah, in fact, Dr. Preeti, like with even like kids at 3 years of age, we give them some, munchies and everything where they actually bite on it and chew, and this helps in, breaking any kind of habits that they have, or they start swallowing correctly. And jaw growth can be corrected so early on also. But it is just that if you've seen the child early is only when we can really treat these things. The more later we go, we can still treat it, but we cannot achieve as great results as we
I
can when growth is on.
Yeah.
So, Dr. Preeti, I think your voice is lagging in between. If you want to switch your internet and check.
Okay, can you hear me?
Yeah.
Yeah.
So, Dr. Preeti, what do you think, like, if this is a problem that because they've done orthodontics before, they've not done orthodontics before, but they didn't realize their signs of airway earlier or sleep problems earlier, and they start realizing this at later ages, like late teenage, 18, 20, or, even at 30. What do you think, like, how can we still treat it via orthodontics?
So, skeletal expanders are something that have come to our in this. They are a big boon because, see, most of the time the airway is mostly related to narrow arch that are not, I mean, opening up the maxillary upper arch can actually relieve a lot of problems. So, skeletal expanders work amazing in such cases. Also, jaw positioners like maxillary positioners, mandibular positioners. There's so many kind of them. So there are many modalities and specific. So only after we look at the case, analyze the case properly, then we can come up to what sort of a prognosis we can give to the patient.
Right, right. Interestingly, Dr. Preeti, I've come across so many of these young teenage or post-teenage, where they're starting to realize that they're suffering from these problems. And what is very interesting, and that struck me a few years ago when I got so much into airway, that your jaw joint, if that is not positioned correctly, or even like a minimal shift in it, is causing a change in your shoulder level, that is causing a change in your hip level, and the whole posture of the body is going for a toss, and they have so much of pain and physiotherapy again and again, and they still don't get resolved. And that's when I felt that we as dentists are so important, that these small changes in your teeth and jaw can really influence so much of your body. And I've seen that with my own mom also. Like, the minute we started aligning her jaw, her 15 years of pain starts going down. And where, so many doctors call it as psychosomatic pain. Like, it's interesting that how much your teeth can
Yes.
change in your body, right?
Yes. So, I mean, I think it is very important to actually identify these markers, you know, uh, probably, train ourselves more to kind of do what actually regularly do, utilize it in correcting these malocclusion. I mean, time too.
Yeah, yeah. And interestingly, some cases are pretty much solved with simple things, like just correctly positioning the jaw and teeth. Simple things like myofunctional therapy. Now, interestingly, in the West, they also call it as tongue therapy because a lot of exercises involve your tongue. And there are celebrities in the West like, Kourtney Kardashian and DJ Khalid. There are some basketball players. These all have started doing
Knew it.
all these therapies.
Yes.
It's so interesting, and they're pretty much fun exercises when you go to see. And we never realize that we pay so much attention to muscles of our body, but what about your face and the tongue, na, today? And that can influence so much of your growth. In fact, interestingly, I came across some fact where your tongue can exert around 500 grams of force.
Wow.
So they call it as a natural palatal expander. So in an early age, when your tongue is always positioning up at the growth ages, your palate will naturally widen. And whenever the tongue is positioned low, you will have a narrow jaw.
Wow.
So it's interesting, and I've also seen it in a lot of my cases. When I make them position the tongue up, I naturally achieve so much expansion of the jaw.
Correct. So, when a child walks to me, these are the three things I absolutely observe: is the tongue position, the breathing, and the lip position also. When there is a lip incompetence, shorter lip, and you train the patient to have some lip exercise and actually achieve that lip competence, there is so much less protrusion of your teeth that you can see even during the growth. So it is
Right.
interesting that our muscles, our appliances that we are gifted with, we have to use it.
Right. And like with lips also, I've seen a lot of people closing their lips with the lower jaw more.
Yes.
This, and you will see a lot of
Correct.
puckering here. So
Yes.
making this feel so much that your lower jaw will still go retruded more. It'll still go behind because this is so hyperactive.
Yes.
And a lot of people have like good cheeks, well-defined cheeks, but they're always covering your jaw. So
Yes.
so they are using this swallowing mechanism.
Yes.
So they are all the more making your jaw narrow and they're all the more retruding the jaw. So these are like small signs, I think, like
When,
dentists, parents
when
should look for.
there's something that you have to look into the upper lip. Sometimes when the upper lip is short, then the child actually forces the lower lip and then the puckering. So always, I mean, go. Your eye has to go to your upper lip, and you will see most of the cases they have short upper lip. Then
Yeah, yeah, I agree. I agree. So, Dr. Preeti, what do you think would be like one piece of advice that you would like to give parents today?
so according to me, any treatment would be successful if it is carried out at the right time and it is planned and executed properly. So for parents, I think just keep looking out in your young kids, in your toddlers, for signs like overbite, underbite, bunny teeth, habits like tongue thrusting or thumb sucking or lip sucking or mouth breathing, and get an orthodontic opinion. uh, you know
Right.
get an orthodontic opinion for your child, and early age is the best intervention that you can have. And then
Yeah.
the onus is on us, as doctors, to analyze the problem and to keep a more holistic approach when you actually want to attain your treatment goals.
Right. I just feel that today parents will be able to identify some signs over there. But I think it's so important that we as dentists today, as a community of dentists, we need to start analyzing and taking in questionnaires for sleep and breathing and start observing these small signs. The minute we start doing that, the parents or the patients will start becoming more aware of their breathing and sleep patterns also, and we'll be able to help these children better. In the end, all we want is a healthy lifestyle for everyone. That's all that we are looking at today, right?
Yes.
So, would you like to add any questions that you would want to address more on to Dr. Preeti? Anything else that you would like to say? Would you have any other questions that you want to add on to Dr. Preeti? Anything that you would like to say?
I have lost you, Ankita.
Yeah. Do you have any other questions that you would want to address on?
all well, because I feel I just want to say that early intervention is best. So, children coming into us early, we can help so much, and
Right.
look up all these signs and make sure that we treat them in time.
Perfect, perfect. So I think there's so much more also that we can talk, because we've done n number of cases and we've seen so much difference in so many patients with all these signs, that I think we should be doing a live again for this, where we can even just discuss cases, sometime again. And
Yes.
I just hope that we are going to be able to help doctors today, patients today from this live, where they can start opening up their vision, start looking at these different signs. Even parents can start looking at different aspects also today. And we can just provide some alternative viewpoints and treatments. Now, this is just going to help us create more awareness, bring about a good health in children as well as in adults. Start looking at posture problems. Also, look at your teeth. Your teeth are also going to cause a lot of posture problems, headaches, migraines. Everything's related. So much is, it's rightly said, like your
Mouth
mouth
the
actually
gateway.
enters to the health. Right. So I thank you all for listening to us, and you know where to catch us. Dr. Preeti runs a practice called Creative Smiles. She's there on Instagram as well. And we are also there on Instagram. Our handle is at the rate Dentition India. And if you have any questions at all, even as doctors, please don't feel shy to let us know. We'll be happy to answer. We are very open to have a discussion, and I'm always very ready to listen to different viewpoints. We are very open to listening to different viewpoints, understanding, and just helping every patient out there. What would you like to say, Dr. Preeti?
I want to say thank you. It was a lovely afternoon talking to you on fun things, and yeah, we hope that we, are able to help more and more children to have good airways, to have better teeth, better occlusion, and better lives, I guess.
True, true. I agree. So I think that's it. And thank you so much, Dr. Preeti. I will see you soon.
Yeah.
Bye.